A dental implant is basically a bionic root. It functions like a root in the mouth, and that can be used to hold a tooth on. You can use multiple implants to hold a bridge or multiple teeth in. You can use it to hold dentures. Basically acts like an anchor to hold something to chew on. Most implants are to replace single teeth. Somebody comes in with a broken tooth or a tooth that's not fixable, you can replace a tooth with an implant. Some people don't have any teeth and they're missing a good ability to chew, or they're not satisfied with dentures. You can use implants to support dentures. You can use implants to replace all the teeth, so they just function as an anchor. Our consult usually starts with the staff kind of doing a basic interview with the patients, find out why they're here, what's going on, if they had any trouble or difficulty or pain or discomfort, and also what's been done prior to us seeing you. Then we usually either have x-rays from the other doctor's office, or we'll take an x-ray, and then I'll come in and just kind of examine the patient and go over what's going on. We'll look at the x-rays and just kind of talk about, okay, how do we fix this situation? Treatment process, sometimes we can do treatment the same day that we see someone, especially if it's something kind of isolated or simple, or it's not a very complicated procedure. Sometimes we'll schedule in advance. Treatments involve, we can either do local anesthesia, IV sedation, different things for comfort. Most people are here for under an hour for most procedures, unless it's a long procedure. We usually check on them that night or the next morning. We'll give them a phone call and just make sure they're doing well. After the procedures, usually I like to see people within about a week or so, make sure they're progressing well. They also have the understanding anything weird, call. Doesn't matter what it is, just call. One of us will answer the phone. With the consultation, I think it's very important because we can determine if a patient's a candidate or not for let's say an implant or an extraction or some other procedure. There's a lot of healthcare issues that may be negative towards doing an implant or doing a surgery, an extraction or something like that. And there's better ways to try and safely do a procedure. So I usually recommend a consult. It's hard to answer something over the phone without knowing who the patient is and what the x-ray looks like and what the issue is that we're dealing with. So usually sit down face to face and figure out exactly what we need to do and how to go about that process.